One of our most recent, and this is such an exciting engagement, and it's with a client that is so incredibly engaged, thoughtful. They really want to do the right thing for their members. We just did an analysis where we looked at the relate for 500,000 people, members. We looked at the relationship between healthcare outcomes and cost and risk. And a few of the really interesting things we found, and some of this is maybe saying it out loud sounds obvious, but to truly see it in the data is so meaningful. Risk, right, is actually higher when you're younger, right? You have less wealth, you have less stability, but your healthcare costs rise as you get older. And so, guiding our plans and how to think about identifying where social risk is higher and costs are higher, you really do need to think about it at the age cohort level. So, coming with that information, I think step one was a big finding for this particular customer. The other piece of it was this customer specifically wanted to do something. They knew they wanted to do something for their maternal health population, and they wanted to do something with food. Maybe, you know, think about those independently, but maybe combined. And what we were able to do is come back to them and say, hey, actually, like, you have pretty high food insecurity within the younger population, within your 20 to 29-year-olds. You're not seeing it necessarily as a large driver of healthcare costs, but it is driving costs in that population. And if you think about that age range, right, 20 to 29, that's going to be, your prime. A lot of pregnant mothers are in that age range. And we were seeing that also with the pregnant mothers, that higher costs, as well as just not as good outcomes, were associated with higher food insecurity, among other things, but food insecurity is what really stood out. And to be able to say to that customer, the data is here and you should do something. They're thinking now about what are the programs that we want to build? How do we engage the right members? And how do we actually provide a holistic prenatal experience to these women, so that we can improve outcomes? And to really see that link between not just outcomes, but costs and our risk scores go all the way through to, okay, we are going to do something and socially determined has recommended that we do A, B, and C. I think that's really powerful, and it's really rewarding to see our customers act on that data, because we are now coming with an ROI, for lack of a better term, right? Like, it is worth it to make this investment, not just because it's the right thing, but because it actually, you won't lose money on it. And that's important, especially today.